Prescribon Medical Education Series Circulation Part 2. Blood pressure. Standard units of pressure. Blood pressure is measured in millimeters of mercury. Blood pressure is the force exerted by the blood against any unit area of the vessel wall. Normal blood pressure is 120 by 80 millimeters. More on blood pressure, see Prescribon Medical Education Series Hypertension. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Resistance to blood flow. Resistance is calculated indirectly by dividing the pressure difference between 2 points in the vessel by the blood flow. If the pressure difference between 2 points of the blood vessel is 1 millimeter and the flow is 1 ml per second, the resistance is said to be 1 peripheral resistance unit, usually abbreviated as PRU. The rate of blood flow through the entire circulatory system is equal to the rate of blood pumping by the heart, that is, it is equal to the cardiac output. In an adult human, this averages approximately 100 ml per second. The pressure difference from the systemic arteries to the systemic veins is about 100 millimeter mercury. Therefore, the resistance of the entire systemic circulation, called the total peripheral resistance, is about 100 by 100 or 1 PRU. In conditions in which all the blood vessels throughout the body become strongly constricted, the total peripheral resistance occasionally rises to as high as 4 PRU. Conversely, when the vessels become greatly dilated, the resistance can fall to as little as 0.2 PRU. In the pulmonary system, the mean pulmonary arterial pressure averages 16 millimeter and the mean left atrial pressure averages 2 millimeter, giving a net pressure difference of 14 millimeter. Therefore, when the cardiac output is normal at about 100 ml per second, the total pulmonary vascular resistance calculates to be about 0.14 PRU, that is about 1/7 that in the systemic circulation. The rate of blood flow is directly proportional to the fourth power of the radius of the vessel. The diameter of a blood vessel, which is equal to twice the radius, plays the greatest role of all factors in determining the rate of blood flow through a vessel. This means that a small increase in blood vessel diameter greatly increases the blood flow. Importance of the vessel diameter, fourth power law in determining arteriolar resistance. In the systemic circulation, about 2/3 of the total systemic resistance to blood flow is resistance in the small arterioles. The internal diameters of the arterioles range from as little as 4 micrometers, 1 micron is 1,000th of a millimeter, to as much as 25 micrometers. However, their strong walls allow the internal diameters to change tremendously, often as much as 4-fold. From the fourth power law discussed earlier, which relates blood flow to diameter of the vessel, one can see that a 4-fold increase in vessel diameter can increase the flow as much as 256-fold, that is 4 into 4 into 4 into 4. Thus, this fourth power law makes it possible for the arterioles, responding with only small changes in diameter to nervous signals or local tissue chemical signals, either to turn off the blood flow to the tissue almost completely, or at the other extreme, to cause a vast increase in flow. Ranges of blood flow of more than 100-fold in separate tissue areas have been recorded between the limits of maximum arteriolar constriction and maximum arteriolar dilatation. Blood pumped by the heart flows from the high pressure part of the systemic circulation, that is aorta, to the low pressure side, that is vena cava, through many miles of blood vessels arranged in series and in parallel. The arteries, arterioles, capillaries, venules, and veins are collectively arranged in series. Blood vessels branch extensively to form parallel circuits that supply blood to the many organs and tissues of the body. This parallel arrangement permits each tissue to regulate its own blood flow to a great extent, independently of flow to other tissues. The viscosity of normal blood is about 3 times as great as the viscosity of water. The viscosity of blood is mainly due to the large numbers of suspended red blood cells in the blood, each of which exerts frictional drag against adjacent cells and against the wall of the blood vessel. Autoregulation controls the effect of arterial pressure on tissue blood flow. An increase in arterial pressure not only increases the force that pushes blood through the vessels, but also initiates compensatory increases in vascular resistance within a few seconds through local control mechanisms. Conversely, with reductions in arterial pressure, vascular resistance is promptly reduced in most tissues and blood flow is maintained at a relatively constant rate. The ability of each tissue to adjust its vascular resistance and to maintain normal blood flow during changes in arterial pressure between approximately 70 and 175 mm is called blood flow autoregulation. Local autoregulatory mechanisms override the sympathetic or hormonal effect. Strong sympathetic stimulation and hormonal vasoconstrictors such as norepinephrine, angiotensin II, vasopressin, or endothelin constricts the blood vessels. These are only a short-term effect. Blood flow changes rarely last for more than a few hours in most tissues, even when increases in arterial pressure or increased levels of vasoconstrictors are sustained. The reason for the relative constancy of blood flow is that each tissue's local autoregulatory mechanisms eventually override most of the effects of vasoconstrictors to provide a blood flow that is appropriate for the needs of the tissue. Larger blood vessels exposed to high pressures, such as the aorta, must have stronger walls to withstand higher levels of tension and are generally reinforced with fibrous bands of collagen. In contrast, capillaries have a much smaller radii and therefore are exposed to lower wall tension, permitting them to withstand pressures as high as 65 to 70 mm in some organs such as the kidneys. Vascular distensibility. A valuable characteristic of the vascular system is that all blood vessels are distensible. The distensible nature of the arteries allows them to accommodate the pulsatile output of the heart and to average out the pressure pulsations. This capability provides smooth, continuous flow of blood through the very small blood vessels of the tissues. The most distensible of all the vessels are the veins. Even slight increase in venous pressure causes the veins to store zero point 0.5 to 1 liter of extra blood. Therefore, the veins provide a reservoir for storing large quantities of extra blood that can be called into use whenever blood is required elsewhere in the circulation. The veins are much more distensible than the arteries. The walls of the arteries are thicker and far stronger than those of the veins. Consequently, the veins are about 8 times more distensible than the arteries. That is, a given increase in pressure causes about 8 times as much increase in blood in a vein as in an artery of comparable size. In the pulmonary circulation, the pulmonary vein distensibilities are similar to those of the systemic circulation. However, the pulmonary arteries normally operate under pressures about 1/6 of those in the systemic arterial system, and their distensibilities are correspondingly greater, about 6 times the distensibility of systemic arteries. The arterial system of the average adult person, including all the large arteries, small arteries, and arterioles, is filled with about 700 ml of blood, and the mean arterial pressure is 100 millimeters. But when it is filled with only 400 ml of blood, the pressure falls to zero. In the entire systemic venous system, the volume normally ranges from 2000 to 3500 ml, and a change of several hundred ml in this volume is required to change the venous pressure by only 3 to 5 millimeter. This requirement mainly explains why as much as 1/2 liter of blood can be transfused into a healthy person in only a few minutes without greatly altering the function of the circulation. Increase in vascular smooth muscle tone caused by sympathetic stimulation increases the pressure in the arteries or veins, whereas sympathetic inhibition decreases the pressure. Thus, an increase in vascular tone throughout the systemic circulation can cause large volumes of blood to shift into the heart, which is one of the principal methods that the body uses to rapidly increase heart pumping. Sympathetic control of vascular capacity is also highly important during hemorrhage. Enhancement of sympathetic tone, especially to the veins, produces the vessel sizes enough that the circulation continues to operate almost normally, even when as much as 25% of the total blood volume has been lost. Arterial pressure pulsations. With each beat of the heart, a new surge of blood fills the arteries. Were it not for the distensibility of the arterial system, all this new blood would have to flow through the peripheral blood vessels almost instantaneously only during cardiac systole, and no flow would occur during diastole. However, the compliance of the arterial tree normally reduces the pressure pulsations to almost no pulsations by the time the blood reaches the capillaries. Therefore, tissue blood flow is mainly continuous with very little pulsation in the capillaries. The pressure pulsations at the root of the aorta are illustrated in figure. In a healthy young adult, the pressure at the top of each pulse, called the systolic pressure, is about 120 millimeters. At the lowest point of each pulse, called the diastolic pressure, it is about 80 millimeters. The difference between these two pressures, about 40 millimeters, is called the pulse pressure. Two major factors affect the pulse pressure. One, the stroke volume output of the heart, and two, the compliance, that is, total distensibility of the arterial tree. In general, the greater the stroke volume output, the greater the amount of blood that must be accommodated in the arterial tree with each heartbeat, and therefore the greater the pressure rise and fall during systole and diastole, thus causing a greater pulse pressure. Conversely, the less the compliance of the arterial system, the greater the rise in pressure for a given stroke volume of blood pumped into the arteries. For example, in old age, the arteries are stiffened with arteriosclerosis and are relatively non-compliant. Hence, the systolic pressure rises. Hence, the difference between the systolic and diastolic pressure increases, and the pulse pressure sometimes rises to twice normal. See the pressure variations figure again. The intensity of pulsation becomes progressively less down the arterial tree. In the smaller arteries, the pressure variation is between 60 and 100, arterioles 25 to 30 millimeters, and capillaries 15 millimeters. Here, the flow is almost continuous. This progressive diminution of the pulsations in the periphery is called damping of the pressure pulses. The cause of this damping is twofold. One, resistance to blood movement in the vessels, and two, compliance of the vessels. Age-associated changes in blood pressure. The kidneys are primarily responsible for the long-term regulation of arterial pressure. It is well known that the kidneys exhibit definitive changes with age, especially after the age of 50 years. A slight extra increase in systolic pressure usually occurs beyond the age of 60 years. This increase results from decreasing distensibility or hardening of the arteries, which is often a result of atherosclerosis. The final effect is a higher systolic pressure with considerable increase in pulse pressure. Dear listeners, this is the end of video circulation part 2.